Okay, picture this. You're just going about your day, maybe staring at your computer screen or reading a book, and then something weird happens. A strange, shimmering light just appears in your vision. It starts to grow. Maybe it turns into a kind of zigzag pattern, and for a few minutes, it is impossible to ignore. And then, just as weirdly as it showed up, it fades away, leaving you thinking, what in the world was that?
If that sounds at all familiar to you, you are definitely not alone. It's a way more common experience than you might think. And it can be kind of fascinating, but let's be real, it's also a little bit scary, especially the first time it happens.
And that's pretty much the perfect description, right? It often starts as this little spot of flickering light, then it expands, sometimes into a C shape, and it has this sparkly, almost electric vibe to it. It feels so real, even though you know it's not. So what do we actually call this glitch in our vision? All right, let's get right to it and put a name to this whole experience, because honestly, just knowing what it is can make it a lot less mysterious and intimidating.
The official term is an ocular migraine. Now, the most important words to focus on here are temporary and visual. This isn't a problem with the eyeball itself. Think of it more like a brief hiccup in the blood flow or the nerve cells that are connected to your vision. And what's really interesting is that for a lot of people, there's no headache pain at all. It's just the visual show.
Now, this is where things can get a little confusing, so let's clear it up. An ocular migraine typically affects just one eye. A classic migraine with aura, on the other hand, affects the vision in both eyes. And there's actually a super simple way you can tell the difference if it's happening. Just cover one eye and then cover the other. If the sparkly light show disappears when one of your eyes is covered, you're likely dealing with an ocular migraine. If you can still see it no matter which eye is covered, that's a migraine with aura, which means the whole thing is starting in the brain's visual center.
Okay, so we know what it is, but the big question is, why does it happen? Let's dig into the actual chain reaction in your body that leads to that bizarre light show.
So it's really like a domino effect. First, something has to trigger it. In response, the tiny blood vessels in your retina suddenly tighten up. That's called a vasospasm, which just means less blood is flowing for a moment. That change can then set off this slow-moving wave of electrical activity that spreads across your brain cells. And that wave is what creates those wild visual effects you're seeing. Then, eventually, the vessels relax, the blood flow goes back to normal, and poof, your vision is clear again.
So what are these triggers? Well, if you get regular migraines, this list is going to look pretty familiar. We're talking about stuff like not getting enough sleep, being dehydrated, bright lights, even certain foods. But the big one, the one that is so often at the center of it all, is stress. And this is where our story gets really interesting.
So, it turns out this whole visual thing isn't just some random quirk your body has. It's actually a clue to a much bigger picture of how our bodies handle being completely overwhelmed. Think about it. An ocular migraine is a short-term physical response to a major trigger, like intense stress. But our bodies have other ways of dealing with being overwhelmed, and some of them are purely psychological. And when you put them side by side, the similarities are, well, they're pretty mind-blowing.
For example, let's look at something called acute stress disorder, or ASD. This is a powerful but temporary psychological reaction that can happen right after a really traumatic event. It's basically the mind's version of a system overload, and it typically lasts for a few days up to about a month. And this is where you see the connection so clearly. Just look at the parallels here. Both are set off by an intense trigger. Both are these sudden, temporary events. One is physical, the other is psychological. And here's the kicker: if they're not dealt with, both have the potential to turn into a more chronic condition. For ocular migraines, that could be chronic migraines. For acute stress disorder, that could become post-traumatic stress disorder, or PTSD. It's like they are two different sides of the exact same coin. The body's alarm system just screaming, "I'm overloaded!"
And hey, this isn't just some abstract theory. The numbers really back it up. A 2022 survey showed that a full 25%, that's 1 in 4 patients with migraine, also had a PTSD diagnosis. That's a huge overlap, and it tells us there's a real, tangible link between people who experience these intense neurological events and those who've gone through major psychological stress. So what's the big takeaway here? If these very different conditions are linked by the same thing, our body's reaction to stress, then maybe the way we manage them is linked too. And that brings us to our final and most practical section.
This is really the heart of it all. If we focus on the root cause, that response to stress, we can come up with a plan that helps us manage both the physical symptoms, like an ocular migraine, and the bigger psychological effects of feeling overwhelmed.
So here's a super simple 4-step plan. First, keep a diary. I know it sounds old school, but there's a reason it works. Tracking your symptoms, what you eat, your sleep, your stress levels, it can show you some incredibly powerful patterns. Second, use that diary to figure out your personal triggers. Third, you got to actively manage that stress. Find what works for you. Maybe it's relaxation exercises, yoga, or mindfulness. And finally, and this is non-negotiable, talk to a doctor. They can rule out anything more serious and help you build a plan that's right for you.
So, in the end, maybe we should reframe how we think about this. That weird shimmering light isn't just a glitch in the system, it's a signal. It's a flare that your body is sending up to tell you, hey, things are getting a little strained down here. It's actually really valuable information.
And that really leaves us with one last, really important question to ask ourselves. When you experience these things, whether it's a visual disturbance or a sudden wave of anxiety, what is your body trying to tell you? Really listening to those signals might just be the most important thing you can do for your health.